Camera, you're pissing me off. So just got back from OHSU for my top surgery consultation, and I mean, overall, it went really well. The biggest thing that I really wasn't expecting is the dreaded question of how long are surgeries, booked up for? When am I looking at getting top surgery? And I'm basically looking at the end of the year. So it's another 7, 8, or maybe 9 months of binder hell. And also just physically feeling like crap. That really killed the mood for me for today. I don't want it to be that way. I want to just be like, okay, well, that's just how it is, and then just like move on. But yeah, it's just one of those things. Everything was going fine, and then there's always something, So I'm honestly, I'm actually just pretty pissed off about how much longer I'm gonna have to wait. But I mean, everything else went okay. I met with Dr. Berli. He will be doing the surgery. He seems like a pretty good guy. Pretty cool. He likes memes. But yeah, I got a lot of questions answered. As for me personally, like what's my situation, what am I looking at? I had a really good feeling, or a very strong feeling, that I would have to go with a double incision, which is exactly what he agreed on. Double incision, for those of you who don't know, it's basically 2 different types of surgeries all in one. Basically, they cut off the nipples, put them to the side, do the cut on the chest, remove all the breast tissue, sew that back together, and then make another cut where the nipples are going to go, and then place the nipples there. So it sounds really weird when I say it that way, but it's kind of like a cookie cutter cut and paste kind of surgery. And I asked where the incisions were going to go. So I'm just gonna kind of show you. So I'm gonna throw up a warning. You might see some chesticles. I'm gonna try and censor myself as much as I can. And again, this is not me being like, here, look at me. Like, no, this is just, I'm trying to show people surgery stuff for just larger chested people and what to expect. So yeah, I'm gonna take off my shirt and binder now for the second time today. Okay, so I mean, sitting like this feels fine. I'm okay with this. This is very, very weird for me. I also have a cat screaming at me, so let's just ignore her. Okay, so basically, I'm gonna do the best I possibly can to like censor and all that, but I might mess up, so bear with me. Please don't flag this as inappropriate. Please don't report anything. I'm just trying to educate and also document this for myself, so because now I'm not having surgery for quite some time, I kind of want a reference and something I can look back on and being like, oh yeah, this is what we talked about, especially since it's all still in my head because I forgot to take notes. Okay, so first and foremost, double incision is it's like 2 cuts underneath the breast tissue. And for me, one of the questions I asked was, because I am larger chested, I already have this line here that's kind of developed just from having a really large chest. And I asked, if they would use that or not. And there was his medical assistant that was also in the room. And she said no, that they would actually probably go a little higher. So instead of here, it would probably be closer to like up here, but it would be flat, if you can imagine that. I can't. I would like to, but like closer up. And then also on the side, it would, so here's kind of where that ends.
There's my armpit for reference. And said it would probably go to about here, but like she went up, so it looks like it's gonna go like up, kind of like that.
Also, because I am very large chested, the scars are going to come around and then up, and they will meet. So it's going to be a very weird shaped W. Both sides. I will have the drains. I asked where my nipples are going to be, because I saw this one video where this guy, his nipples were below the incision, which was absolutely bizarre to me. I kind of freaked out when I saw that, so I made sure to ask, where are my nipples going? And so when Dr. Berli took over, he told me, like, here's my chest. And so he said the incision, so because we're looking at like right here, which translates to about, here is where it's gonna go and then meet up. And then he said the nipples would be kind of like here. So it is going on top. I'm not symmetrical at all. But yeah, so like normal. I mean, it looks like it would be normal. It's really, really hard to imagine for me because there is just all this weight up here. Something else that was talked about is when they were going over my family history for different things. Blood clots run in my family. My sister got them for birth control stuff. Or got them from birth control, not for birth control. So she took birth control, developed blood clots. That was the thing. And then my mom recently has developed quite a large clot, but that was because she was on a plane for like 13 hours going from the United States to basically LA to Auckland, New Zealand. And just sitting still for that amount of time just did something to her, and she's got a blood clot that goes from her hip basically down to her mid-thigh. So that was really, really scary to hear about. And so when I was talking to the doctors about that, when I had to sign all that waiver information of, I understand I'm going to be put under and this and that and could cause this, and this, and in very rare cases death, he circled one of them that was in the high-risk kind of section, and he said, we're not going to not assume that this could be a factor. You could very well be a very high-risk bleeding patient. So he started talking to me about blood transfusions, which is a little scary. But he seemed super confident. He told me he's done at least 200 of these surgeries, and by the time he gets to me at the end of the year, it'll be close to 300, maybe even a little over 300. So while, yeah, it is scary because me as an individual, not really having experienced anything like this before other than just my little loop recorder surgery, which I'll get to that scar in a minute. It's scary, but I feel safe. I feel okay. I know that once I'm put under, they're holding my life in their hands, kind of a thing. I feel that I am in good hands, and that they will take care of me, and they're going to do everything they can to make it go as smoothly as possible. But he did, for legal reasons, have to go over that with me, which I appreciate. One of the other questions I had was, the scarring. And this is talking to his medical assistant. I asked her where the scars would be and how far back, and then she told me that they would meet in the middle. And then I made a mention that, it seems like a good 98%, I'll even say, of videos or pictures I've seen of top surgery. They're all very large and pink and angry looking for a long, long time. And that wouldn't bother me. That's just what comes with being bigger and having to do a double incision. But my question was just like, well, hey, I have scars, and they heal white, and so I showed her, my arm scars, which you can see there. Yeah, these went untreated. They should have gotten stitches, but they didn't. Also, a little acne going on there. Yeah. So they heal white, and like you can hardly see them. And she's like, well, that's a really common area to get scars, blah, blah, blah. I'm like, well, I also had, this. And so here's this scar. Where am I? Right here. That's when I had a loop recorder implant put in to monitor my heart. I had it put in. A couple years later, they opened up the same scar and pulled it out. So this scar right here was 2 different surgeries, and that also heals white, and it's actually flat and not raised like these ones are. And she was looking at that, and she's just like, well, you are in that superb, superior, chest healing really, really well range, so yeah, I'll take it. My scars apparently are going to heal very, very, very well, so long as there's no complications and I'm not an idiot and do something I'm not supposed to after surgery. So that made me feel pretty good. Looking forward to the recovery process. Not necessarily the pain, but just watching how my scars will heal, hopefully a lot better than what I've seen for other people. Oh, so I also brought up, wanting hysterectomy, and, sometime further down the line, phyloplasty, which is bottom surgery. And so just knocking out as much as I could today. I don't have a whole lot of time to just be able to take weekdays off of work to do sorts of things like this, so I want to make as little appointments as possible while covering the most ground. And talking to Dr. Berli about the hysterectomy, because they are plastic surgeons, they don't necessarily deal with organs and stuff like that, so he sent a referral to their department upstairs from them who does. So it's really cool because there's a department at OHSU that deals specifically with trans men related hysterectomies. So I wouldn't even have to go to a women's clinic to be able to be like, so yeah, here's this big man wanting his what removed? Yeah, so just to avoid all kind of awkward there, they're just going to direct me right to another program within OHSU that deals with my specific situation all the time. So I'm getting referred there, and hopefully we'll hear from them in a couple weeks. Dr. Berli also said that it would be better if I had the hysterectomy first, as opposed to, as far as having the hysterectomy before I have top surgery, because it had something to do with my risk level of surgery, and it would be more of a risk to have top surgery after my ovaries and all that were removed. So he's wanting, but not necessarily requiring, that I get that done first, which, I mean, if I can fit that in before the end of the year, then sure, yeah, remove. So yeah, I'm just going to be doing all of that. Just get rid of it all. And so yeah, I'll be waiting to hear about that, hopefully very, very soon. And if I am able to do this hysterectomy before the top surgery, that will really help me, I think, deal with this really long period of time before I get the chesticles removed and I drop 20 pounds. I wish that was an exaggeration. Dr. Berli also mentioned, going along with the hysterectomy, that by removing my ovaries, the testosterone that I'm injecting into my body might convert to estrogen because I'm no longer producing estrogen, so my testosterone intake levels will have to be lessened severely, especially before surgery. So there's going to be a lot of adjusting with the hysterectomy as opposed to the top surgery, both if I do it before and especially after. So I've got quite a bit of adjusting and all that to do before either one of them. And then talking about phyloplasty, he was very upfront and honest with me, and which is something I appreciate, absolutely. I am a bigger guy. And he said that, well, I'm paraphrasing. This is not literally at all what he said, but bottom line is I am going to have to lose quite a bit of weight to be able to make room down there, which understood. This lower surgery isn't something that I really feel like I need, absolutely, or really want within the next few years. So yeah, I'm okay with being able to get the hysterectomy taken care of, definitely the top surgery, and then just feel better here to be able to feel like I can go to the gym, work out, and not feel so self-conscious about having such a large, awkward chest for a man. And so hopefully that will proc some weight loss. I will note that since moving from Klamath to Portland, where I am now, from my last consultation with just my regular doctor there in Klamath until today, which was I think maybe 2 or maybe even 3 months ago, I have lost 10 pounds. I don't know where, I don't know how, and this is almost sounding like a Disney song. So I definitely want to start eating better, but financially right now I can't, so working out is really I'm gonna want to start doing. Especially I have free gym access at this apartment complex that I have. There's a pool, which I probably won't be touching anytime soon just because of this. So if I could just start doing like more chest exercises and get rid of that, then I don't see a problem of me scheduling a phyloplasty surgery within the next 5 years. So there's that. Overall, I'm doing okay. Disappointed that I'm going to have to wait so long, but I have to keep telling myself that I am so much farther now than I was before, and that I have to just keep going. I mean, look how fast this 1 year on T went for me. So I just kind of have to keep trugging along. Definitely have to get some new binders because the ones that I have right now are absolutely terrible. I've had them for 2 years, so they're just falling apart, and 2 of them I think are too big now. I think I've lost weight just in my just chest area in general. Maybe that's where the 10 pounds went. I don't know. So they're just not fitting right. So yeah, I'm gonna have to look into that. Other than that, I mean, that was my consultation. I hope that helps somebody. If not, future Brenton, how's it going? You can do it. I believe in you. I would have to. I'll see you guys later.